We've been hearing a lot about how Israel's giving out vaccines against COVID faster than any other country, but the Palestinians have been slow just to get supplies. All around the world there are vaccine haves and have-nots, but this is one of the starkest examples because people here live and work closely together. It's a complicated picture.
بتجيبوها ورقة سلام بس احنا بندبرها ماشي؟ اوكي اهلا وسهلا.
Dr. Fadi, I'm Yolande Knell from the BBC.
I've come to one of the best Palestinian hospitals, but it's in East Jerusalem, part of the Palestinian territories annexed by Israel and under its full control. So here Israel is vaccinating Dr. Fadi and the rest of the medical staff. But not the patients, who come from across the occupied West Bank and Gaza Strip.
So now that the vaccination programme started, do you feel a bit of a sense of relief that there's more protection for you and your staff?
Not that much.
Really? Why not?
I got the vaccine, but I'm not relieved. We were not able to deliver vaccination to our patients, to our families back in the West Bank and Gaza. There is a problem of inequality. Yeah. You don't feel happy that you are getting the vaccination and the other part of your people cannot.
What makes him feel worse is that the healthcare systems in other Palestinian areas are struggling so much more.
There's a hot debate about who should be vaccinating Palestinians in the West Bank and Gaza. Those who think it's Israel's responsibility point to the Geneva Conventions. Those who say it's up to the Palestinian Authority look to the Oslo Accords. It all adds to the long list of unresolved issues that experts on international law disagree on here. So we've come from Jerusalem into Ramallah through the Israeli checkpoint over here.
I notice a lot of people without masks here in the West Bank, even though infection rates are high. And many people are wary of being vaccinated. Manal is one of them, even though she's seen all her acting work dry up.
And there is a kind of this discrimination because in the end we are so much in connection with the Israelis, either by people working there or on your daily life. They are controlling our everyday life. So it is unfair that they got the vaccine and we are not.
Will you get the vaccine as soon as you can?
I'm not with the conspiracy theory at all. I know that there is a virus. I know that it is scientifically and medically approved. But with the vaccine, I don't know if I want to take it or not.
The Palestinian Authority says Israel has a duty to give vaccines to Palestinians, but it's not officially asking for them. Its politicians don't want to look weak, as though they can't handle this crisis. The Hamas government in Gaza doesn't want to look weak either. Technically, the Palestinian Authority should be sending it vaccines, but it's also asking Qatar for help.
But at this building site, the nuts and bolts of the situation are seen very differently. Raoul relies on workers from the West Bank and is pushing for Israel to vaccinate them. They're essential to both economies.
We are depending on 65,000 Palestinian workers. They are working in the core jobs of the construction, and we need them because without them we cannot construct. Now, I think this is logic that also we have to vaccine the Israeli people and also the Palestinians that are, at least that are working with us.
When you're putting your argument to the Israeli government about the Palestinian workers, what do you say?
First of all, it's human, okay? Because they are our neighbors and they are not in a very good condition, economically condition.
Mohammed is from Hebron. He's been staying in Israel, away from his home and his family for months, so he can keep his job.
أنت بدك تطعم؟
أكيد يعني احنا في انتظار هذا الشيء، احنا كلنا يعني سواء عرب أو يهود أو بغض النظر إنه أنا طعمت أنا محصن من المرض بإمكاني بعد فترة معينة إن أنا أرجع على عائلتي.
The Palestinians are working with the World Health Organization and doing some of their own vaccine deals. Israel says it's prioritizing its own citizens, but it isn't ruling out vaccinating more Palestinians. Already it's giving doses to prisoners in its jails. Doctors say it makes sense for herd immunity.
We are living together. We almost have no borders. If we vaccinate the Israelis and we don't vaccinate the Palestinian people in West Bank and Gaza, you still cannot break the chain of infection. You cannot fight the pandemic very well.
This pandemic's been revealing. Israel's international connections, its money, its reputation for science all helped it to get vaccines, while the Palestinians, relatively poor, stateless and a lot less organised, have been at a big disadvantage. It's clearly shown the interdependence of both sides, but also the deep divisions.